According to Hagen-Poiseuille's law, which factor has the most significant impact on the flow rate through an ECMO cannula? A. Viscosity of the blood. B. Length of the cannula. C. Internal radius of the cannula. D. Pressure gradient. Answer: C. Internal radius of the cannula. Explanation: the Hagen-Poiseuille equation states that flow, Q, is proportional to the fourth power of the radius, R4. Even a small increase in the internal diameter significantly reduces resistance and increases potential flow compared to changes in length or viscosity. Which of the following is the standard unit used to measure the outer diameter of an ECMO cannula? A. Gauge, G. B. French, FR. C. Millimeters, mm. D. Inches, in. Answer: B. French, FR. Explanation: 1 French unit is equal to 1/3 millimeter. Therefore, a 21 FR cannula has an outer diameter of 7 millimeters. When selecting a drainage, venous cannula for VA-ECMO, what is the primary goal regarding size? A. Matching the size of the arterial cannula. B. Selecting the smallest size to prevent limb ischemia. C. Selecting the largest size that fits safely in the vessel to minimize resistance. D. Choosing a size based solely on the patient's height. Answer: C. Selecting the largest size that fits safely in the vessel to minimize resistance. Explanation: drainage is often the limiting factor in ECMO flow. Because venous drainage relies on gravity or negative pressure, suction, using the largest possible cannula minimizes the risk of chatter, vessel collapse, and hemolysis caused by high negative pressures. A 15 FR arterial cannula is being used for a peripheral VA-ECMO circuit. What is a common complication associated with this specific cannula site in the femoral artery? A. Superior vena cava syndrome. B. Distal limb ischemia. C. Pulmonary hypertension. D. Left ventricular hypertrophy. Answer: B. Distal limb ischemia. Explanation: large arterial cannulae in the femoral artery can obstruct antegrade blood flow to the rest of the leg. This often necessitates the placement of a distal perfusion secondary cannula to prevent limb ischemia. In neonatal ECMO, what is the typical range for venous cannula sizes? A. 8 FR to 14 FR. B. 15 FR to 20 FR. C. 22 FR to 28 FR. D. 5 FR to 7 FR. Answer: A. 8 FR to 14 FR. Explanation: due to the small diameter of the internal jugular vein in neonates, cannulae usually range from 8 to 14 French to achieve the required weight-based flow, approximate 100 to 120 ml/kg/min. Which physical property of a cannula increases as the length of the cannula increases? A. Flow rate. B. Radius. C. Resistance. D. Compliance. Answer: C. Resistance. Explanation: resistance is directly proportional to the length of the tube. A longer cannula, like those used for femoral to atrial drainage, will have more resistance than a shorter cannula of the same diameter. M numbers or pressure flow curves provided by manufacturers are used to A. Predict the patient's blood pressure. B. Determine the oxygenation capacity of the membrane. C. Calculate the expected pressure drop across a cannula at a specific flow rate. D. Measure the anticoagulation levels. Answer: C. Calculate the expected pressure drop across a cannula at a specific flow rate. Explanation: every cannula has a pressure flow profile. Clinicians use these charts to ensure that the desired flow can be achieved without exceeding safe pressure limits, typically keeping negative venous pressure greater than -100 mm of mercury. For a dual-lumen Avalon cannula used in VV-ECMO, where should the drainage ports ideally be located? A. In the aorta. B. In the SVC and IVC. C. In the left atrium. D. In the hepatic veins. Answer: B. In the SVC and IVC. Explanation: dual-lumen cannulae are designed to drain blood from the superior vena cava, SVC, and inferior vena cava, IVC, simultaneously, while the return lumen ports blood directly toward the tricuspid valve. What is the effect of using a cannula with side holes near the tip? A. It increases the risk of clotting. B. It decreases the total flow rate. C. It improves drainage by preventing the vessel wall from being sucked into the tip. D. It is only used for arterial return. Answer: C. It improves drainage by preventing the vessel wall from being sucked into the tip. Explanation: side holes, fenestrations, allow for multiple points of blood entry, which helps maintain flow even if the distal tip of the cannula becomes partially occluded by the vessel wall. If a clinician needs to increase ECMO flow but is hitting the limit of the current drainage cannula, observed by line chattering, the most effective solution is to A. Increase the pump RPM significantly. B. Add a second drainage cannula, multi-stage or additional site. C. Give the patient more vasopressors. D. Shorten the ECMO tubing. Answer: B. Add a second drainage cannula, multi-stage or additional site. Explanation: if the physical diameter of the cannula cannot handle more flow, attaining its maximum V limit, increasing RPM will only cause cavitation and hemolysis. Adding another drainage source increases the total cross-sectional area for blood return.